My name's Jodie Williams and I'm a Health Improvement Practitioner at the Tawa medical practice. I help people with all sorts of problems of living, so that could be physical things, mental things, emotional things, anything that's impacting on health and wellness. They're fully funded appointments and I see people of all sorts of ages and stages and all sorts of problems of living. We work a lot with behavioural change. That's based on the idea that it's our behaviours that contribute to our health outcomes. And one of the most common things I see underpinning that is actually people's mental health, emotional well-being as well. I would often find women will access the service for something like a sleep issue, for example. But when we dial it back and actually find out what's going underneath, it's often due to stress or some sort of emotional dysregulation. Having a background working in mental health means that I have understandings of some of the nuance or complexities of those things, and what I do in the role is I try and really simplify it down to just like one or two core ideas or core structures that we can build on. So one of the main things I would work with women is regulation of the nervous system, for example, and also normalising stress and anxiety as a part of life. Women will come in and they'll be having an experience related to acute stress. And it's actually just really helpful for these people to hear that that's actually normal. It's not comfortable and it's not easy, but there's nothing inherently wrong with them for having that response. And can we also find some way of finding some calm or some peace or some emotional regulation while there's a storm going on? People often come in here not really aware of how mental health impacts on them. The way I describe it is like we can feel like we're lost at sea, or we can feel like we're lost somewhere and we don't have a map. So one of the things that I find helpful about the Health Improvement Practitioner sessions is we can start to create a bit of a map for that person so that they can go, oh, I'm here and I want to get to that place over there. So now that I know that I'm here, I can figure out how I want to get there. Having an awareness of our mental health and how our mental health challenges show up for us personally mean that we can start to navigate getting towards our home base again. When women are healthy, it's better for families and it's better for communities. Women face many different health challenges and concerns that until recently haven't really been getting much airtime, and women were fearful and didn't understand a lot of these changes, and often that would mean they wouldn't go and seek support or assessment from their GP or anyone else. It's important that we talk about these sorts of things so that we can engage with women more and normalise experiences and encourage people to seek support and services and assessment when they need. And also women have different challenges than men, and that's health challenges as well, and also challenges with accessing services due to many various reasons. It's important that we wrap around our women with information and support and encourage them to seek support and assessment when needed. One of the things that I often see is women prioritising everyone else's health before their own. It is a relief for a lot of women when they come in here and start talking about themselves, and having a safe environment in which to do that. Encourage women to, as much as possible, seek support that you're entitled to and that you need. There's something really satisfying about sitting with someone and giving them the care and attention that they deserve, seeing how that can transform people.